This last week, we reported the World Health Organization had ended the emergency phase of the Mpox outbreak. Mpox, formerly known as monkeypox, but with summer gatherings coming up, the CDC is warning there could be a resurgence. Dr. Kumar with Austin Gastroenterology joins us this morning to talk more about it. Dr. Kumar, good morning. How are you?
Good. How are you?
Yeah, thanks for coming on. I'm doing well. So why does the CDC want anyone to let their guard down here? You said there's been a resurgence in Chicago.
That's exactly why. So just to remind ourselves of Mpox, the virus formerly known as monkeypox last year, 80,000 cases globally. In the United States, 30,000 cases. Thought to have been brought over from Europe. Usually the sector in which you're seeing it is in gay and bisexual men. While it's not sexually transmitted, it is transmitted by skin-to-skin contact. It's a virus that causes a painful skin rash with fever. Very few deaths, about 40 deaths from it, so it's not very it's not very lethal, but in people that are immunocompromised, HIV, on chemotherapy, it can be lethal. But most people that are infected just get this painful rash that lasts weeks, and then they transmit it to others through intimate contact, skin-on-skin contact. And so while there were 30,000 cases last year, then we've seen a drastic fall off. In Chicago, we've seen about 12, 15 cases come back up, and everybody's saying, like, keep your antennas up. It's summer. People are gathering again, and be aware of it.
Yeah, and he said a lot of these people are vaccinated, which the vaccine, many of them got the vaccine a year ago. Is the vaccine starting to wane, do you think?
Yeah, it's hard to know exactly why, but you're right. About half the people that were infected were already vaccinated. And so there is a vaccine that's available. It could be that the immunity is waning. Not all vaccines are effective in everybody. So if the vaccine is only 50% effective, it's still better than nothing. And the people that got infected, even though they were vaccinated, the severity of the illness was less. And so there's still advantages to being vaccinated, but also important is understanding that it's not done yet, and so to be careful with your behavior. So if you're being intimate with somebody with a skin rash, you need to be careful about that this could be Mpox, and to be open about these skin rashes if you're, meeting somebody. And also for health professionals to know that it's still out there, and so when you're treating people with a skin rash, that this should be in the differential.
Yeah. Is there any updates in what we know about how it spread? You said it's skin to skin. Is there any information about surfaces or anything like that now? Or
that's a very good question. And we know that it's not transmitted on surfaces. So casual contact is not something that we need to live in fear of. You don't need to worry about catching it off of elevator buttons, toilet seats, and things like that. It's not casual contact of occasional rubbing up against a viral particle. It's really prolonged contact that it takes a little while, so it's intimate contact. And so the rest of us, that don't have these skin rashes, don't need to be living in fear. But in that population, 30,000 Americans were in that group last year, and so right now it's at a lull, only 12, but that 12 just came up in the last month. And so just being aware that it's out there still, and that we still need to be careful for it. And if you're in these high-risk groups, the vaccination, while not 100%, is still better than nothing.
Yeah. Dr. Kumar, good info as usual.
Thank you.
If you have a question for Dr. Kumar, you can email us at askdrkumar@gmail.com. And you can check out his website, drkumar.com. We'll be right back.